I'm back with Dr. Kathleen Rousche from the National Heart, Lung, Blood Institute. And what we want to talk about in this segment is really from two perspectives. We want to talk practically about, so I'm a postdoc or I'm finishing my fellowship, and I'm really interested in innovation and technologies. And I want to know how I begin taking maybe a good idea from the lab that I've been working in and how I can move through the NIH's portfolio of supporting mechanisms from support and development to actually forming a company, testing my idea, and then commercialization. Could you protect, you've got a great story of a successful kind of person who's gone through that pathway. Could you talk to us a little bit about some of the funding mechanisms that are available for us?
Sure. Our office focuses sort of after a basic R01 grant, leading through to navigating the FDA and the small business program. But we recently launched a new program called catalyzed. And the intent of catalyzed was to sort of provide that resource to the innovator that they would understand how to get from A to Z, you know, and not have to access a bunch of disparate programs. Mm-hmm. But catalyzed program have different funding opportunities to get across the developmental path. Mm-hmm. So in the past, we've had investigators, you know, have early Young Investigator Awards, and then perhaps an R01, and perhaps come in for an early stage catalyzed grant. So catalyzed is divided into, has several components to it. It has a earlier stage product definition component where we offer specific RFAs to develop drugs, diagnostics, and devices. And then we also have a preclinical portion of catalyzed that's going to be launched this year. So that'll get you, you know, for a little bit further along through preclinical development to the FDA. The catalyzed program is also really important because it has a coordinating center also to offer product development expertise. So the innovator isn't alone, but is sort of surrounded by a team at NHLBI and through the coordinating center so that they understand how to move their great innovation coming out of a lab or a basic R01 grant through to commercialization.
And you were talking, Dr. Rousche, about platelet biogenesis story, about someone who was successful in kind of making that journey from idea to forming a company through the SBIR sort of program. Can you speak to that a little bit just as an example?
Yes, we had a project come through the NCI program. The company that came out the end is Platelet Biogenesis. There's a huge clinical need for platelets. You know, they're the band-aids of the bloodstream. Human donor platelets are expensive because they have a short half-life. And this concept was to develop, you know, platelets outside the body. And Jonathan Thon was the PI on the NIH Centers for Accelerated Innovations proof of concept grant. And then he took that idea and made a company. And then he applied for small business funds. And then he's since garnered other support, you know, outside of federal funds to bring his idea, you know, towards commercialization.
And that's really the model, right? Where you're providing the support services and some of that initial funding for time and capital expenditures that a small business otherwise couldn't afford, take some risks in terms of developing technologies that the peer reviewers think have promise for helping our patients, and then allowing them to pass through what is that they call it, the chasm of death from a good
valley of death. Mm-hmm.
The valley of death, maybe a chasm. Well, it's not quite broad enough. It needs to be broader.
Big holes, let's call them.
But yeah, but the idea that you kind of help people through that journey, you help them navigate past some of the commonly made mistakes and help move them faster so that good ideas become good products sooner.
Right, and if you are a company already, you can access the Catalyzed program. It takes academic innovations as well as innovations coming out of a small company. And if you access the more formal small business program, this is a great opportunity to access non-dilutive funds. No repayment is required. It's not a loan. The IP is retained by the small business. And having secured a federal small business grant can provide leverage to attract, other non-federal funding and collaborations.
Yeah, big time. I mean, we've seen that across a variety of the projects that we've funded with you, that it's almost a badge of honor to have been selected. And you're almost like, you've undergone a peer review in a way, or a deep dive, and it provides, as part of your pitch, I think, a lot of comfort to another investor that others have seen the value in your work, and that you're worthy of further investment. So I couldn't agree more. So I think this catalyzed program sounds great. And we can go where we go to the, and we just have to Google
Catalyze NHLBI.
Okay.
You'll receive information about the catalyzed program. Contact me directly and I can put you in touch with the coordinator.
Awesome. And, and last, before I'd be remiss if I didn't tell our listeners about the upcoming CAPCAT submission. So if you go to the Google and you type in CAPCAT, call for applications, there's an open application right now that you can apply for your point of care technology idea, if you have one, in the heart, lung, blood, or sleep space. And so, Dr. Rousche, I really appreciate you taking the time out of your day to speak to what the NIH is doing to support innovation. I know the Cardiovascular Digital Health Journal listeners are really a high value target for your services. So I'm sure they're going to derive a lot of value out of these 3 recordings. So again, on behalf of our team, we really appreciate, Dr. Rousche, your time, and are very grateful to you for joining us.
Thank you, Dave. I just also wanted to mention that there is a new office that was recently established in the Office of Extramural Research at NIH called SEED, Small Business Education and Entrepreneurial Development. The SEED office was modeled in part by the Innovation Office at NHLBI and serves all institutes at NIH. So it's of interest to innovators outside the heart, lung, and blood sleep space. And just want to reiterate that, our office is here to serve the innovator community, to turn innovations into products that will have health, economic, and societal benefit. I appreciate the opportunity to talk about our office today. And you know where to find me if anybody has any questions.
Absolutely. Well, thank you again, Dr. Rousche. And I can just tell, if anybody is on the fence and they have a good idea, please check out the resources that Dr. Rousche has outlined. They are extremely robust, and her team is really excellent. And we're very grateful for you providing these services and for describing them today to our listeners. So Dr. Rousche, again, thank you, and Happy New Year.
Thank you. Same to you, Dave.